Hello, everyone. Thank you for coming back after that very short break. We do have a longer break after this session. We've had an amazing morning so far, and my head is spinning, and I've written a lot of notes to ensure I can follow up with various people and various people's work. And I'm hoping that's what you're doing too, because that's what these events are really about, helping you connect with the people you need to connect with. I'm Mandy Charman. I'm the Senior Manager of the Outcome Practice and Evidence Network, and I'm the host and the facilitator for this session. First of all, let's acknowledge country. I would like to acknowledge the traditional custodians of the lands we're zooming in from today. I'm on the Wurundjeri lands in the lovely Macedon Ranges, and I'd like to pay respects to elders past and present, Aboriginal colleagues in the audience with us today, and the Aboriginal families and children we all work and walk alongside. Thank you for making time out of your busy schedules. I do know how busy everyone is, so we feel very privileged to have you all here with us. Now on to a little bit of housekeeping. Please, if you open your chat box up, so as we're going through our sessions, put any reflections, thoughts, expressions of appreciation or questions in the chat. The presenters love to see those and love to have something to interact with as we go. We will also be putting the resources our presenters provide us into the chat as we go as well. So it's another reason to have the chat box open. If everyone can please mute themselves. This session is being recorded, so hopefully you'll feel comfortable leaving your cameras on because it's lovely having faces in the gallery. But if not, that's all good too. If you have any tech issues, we do have some advice on the screen there. Matt Edwards, who is our extraordinary organizer at the centre, has put his number in for any help. So if you wanted to drop that number down, just in case there are any issues, please just contact him. Often, as we all know now, if you leave the Zoom room and come back, often that sort of sorts things out. We have had a few issues today, which is a bit unexpected, but we're just rolling with it. So let's just all roll with it. Okay. We also, before we go into our session, want to thank our major sponsors, VACA, Anglicare and CSNet. We have CSNet doing a little bit of a presentation for us in this session as well. They're a wealth of knowledge about all things outcome. And we also have sponsors Berry Street, Impact Initiative and WCIG to thank as well. We really, the sponsorship, the attendance and the support of Open's critical champions is so important to our work. For this session, we have 3 insightful presentations lined up for you. First, the Parenting Research Centre will share findings from the Parenting Today in Victoria survey, offering a snapshot of parents' experiences, concerns and support needs. Next, Kids First will present Easing the Burden, Kids First Australia's early help model. And finally, last but not least, Carolyn Chisholm and the Impact Initiative, one of our sponsors also presenting, will present from risk to resilience, strengthening families through early intervention. And finally, we have an amazing session from CSNet, so stick around for that. Okay, for our first session, Insights from the Parenting Today in Victoria survey. This is fascinating. A snapshot of parents' experiences, concerns and support needs. We have Dr. Mandy Kienhuis and Dr. Catherine Wade from the Parenting Research Centre. Dr. Mandy is a research specialist with the Parenting Research Centre. She's had over 15 years experience as a psychology researcher with experience leading, conceptualising and conducting research. Dr. Kienhuis has experience as a clinical psychologist and has content knowledge in the areas of clinical psychology, psychological assessment, developmental psychopathology and developmental transitions and parenting. And Dr. Catherine is a principal research specialist at the Parenting Research Centre. She leads research evaluation and analysis activities at the centre with a focus on evaluating the implementation and impact of initiatives aimed at improving the lives of vulnerable families across Australia. Dr. Wade is also a research affiliate with the Faculty of Health Sciences at the University of Sydney. It's my great pleasure to welcome Dr. Mandy and Dr. Catherine. Over to you.
Thanks, Dr. Mandy. Wonderful. Thanks for
It's a
that introduction.
you.
And thanks for having us at the Open Symposium. We're thrilled to be able to present some of the findings from our Parenting Today in Victoria surveys. I'll hand over soon to Mandy to explain why we're referring to it as surveys. But we've got lots of lovely data to share with you and hopefully give you some insights that are relevant to the work that you're doing with families in Victoria. I just will add to the acknowledgement with our own. Before we start, we'd like to acknowledge the traditional owners of the lands and waters in the various locations that we're all coming from today. For myself, I'm on the lands of the Wadwurrung people down near Geelong in Victoria. And I wish to acknowledge the Wadwurrung people as the custodians of these lands that have never been ceded. And I'd also like to pay respect to the elders, past and present, of the various communities that are represented online, and acknowledge any Aboriginal people who might be joining us today. So I'm going to hand over to Mandy, who's going to take you through what Parenting Today in Victoria surveys are and some of the amazing findings that are relevant to your work.
Thanks, Kath, and hi, everyone. So Parenting Today in Victoria. So with funding from the Victorian Government, Department of Families, Fairness and Housing, the Parenting Today in Victoria study was established to provide a credible snapshot of how Victorians are faring in their parenting roles. So it's a series of large-scale representative surveys repeated every 3 years. So since 2016 and again in 2019 and 2022. And we're currently preparing for our 2025 survey. So we've already started that process of stakeholder consultation around areas of interest and planning. So today's presentation focuses on our findings related to parent experiences, help seeking, parenting programs. So just a small part of all the information that we have from the survey. And at the end, we'll also mention a current extension study that's almost ready to go in the field, and that's focused on service-connected families. So at the end, I'll talk a little bit about that and ask for your help in engaging families in that. So before I go any further, I'd like to acknowledge the parents of Victoria who've participated in the surveys over the years, the Victorian Government for their ongoing support, and also my research colleagues at the Parenting Research Centre who have contributed both in the past and the present, and there's a few of them there on the slide, and also thanks to our project board. So I'll start off with taking us through a few details of the methodology and the sample, and I could sort of tell you much more, but given the time, I'll spare you the details on that. But if you are interested in more details, you can access our technical report from our website, and I will be providing some links towards the end. So we use a random dial telephone survey, which is conducted by Ipsos. And in order to get our sample size of about 2,600 parents, we have to, Ipsos has to make a large number of calls, over 100,000, to get that target sample. In 2022, we had 133 questions in the survey, and it took on average 33 minutes to complete. So in 2022, we obtained a sample of 2,602 parents with 43% males and 57% females. To be eligible for the survey, respondents needed to be a parent of a child between birth and 18 years. And when completing the survey, if parents had more than one child, they were asked to focus on the child with the most recent birthday. And surveys were conducted in English or one of 5 community languages. So I won't read all the details on this slide, except to say that the sample approached representativeness according to ABS data and was weighted on parent education to improve representativeness. And the age of the focus child was 8, the average age was 8 years, and 53% boys. So now to our results. So our findings suggest that most parents are faring well, have access to the support that they need from family and friends, are open to the idea of accessing professional support when they need it. So 84% say they're confident in their parenting. Around 3 in 5 parents of preschool children say they read to their child daily. 98% of parents use play or everyday activities to engage their children in learning. And 90% say parenting is rewarding. But 51% say it's demanding as well, which probably is not surprising. So 46% of parents report their child's sleep to be of concern. And a finding that as a team we found sort of quite concerning ourselves. Almost half, so 45% of parents are experiencing at least moderate current psychological distress, and that's using a validated measure, the K6, and 7% are reporting very high distress on that measure. We've seen a trend or a pattern showing an increase across waves in parent distress. So these different coloured columns are the different waves of the survey, 2016, 19 and 22. And the clusters of columns represent low distress, moderate distress and serious distress. So as you can see from the graph, we've seen a decrease in low distress and alongside that, an increase in moderate and serious distress across waves. These findings about shame, guilt, self-compassion and self-care might not surprise you from your own work with parents. So 16% say they struggle with feelings of guilt or shame about their parenting. 37% say they're hard on themselves for not being the kind of parent they really want to be. 56% say they forgive themselves when they make mistakes as parents. So that's 44% who say that they're not forgiving themselves. 40% say they regularly do things to help them to relax and re-energize, so they're engaging in self-care. And this has decreased from 55% when we had that same question in 2019. Some good news, 8 in 10 parents have someone they can turn to for parenting advice, and 76% say they turn to family first. However, this does highlight that quite a significant proportion of parents are missing out on support. Outside of family support, parents are asked what sources they'd used when they needed information or advice about raising their children over the previous 12 months. And outside of family, again, not surprising, the most highly endorsed sources of parenting information were online information with 85% used, and asking other parents of friends at 84%. And you can see here on the slide also that educators, GPs and other health professionals are also high up on the list there. So I mentioned that 85% accessed information online, and we've seen a trend for this to increase over the waves of the survey. It's a small increase, but an increase over the 3 waves from 79% in 2016. And we also ask about parents' use of the raisingchildren.net.au resource, and I'll talk a little bit more about that later. But when we measured that in 2019, it was 18% of parents had said they'd used, and then in 2022, it was 35%. So about doubled since the previous survey. In our last wave of the survey, we had some questions to explore parents' child mental health literacy. So most parents say they're confident in knowing their child was developing a mental health problem and that they would know where to go if they needed professional help with child behavioural or emotional problems. However, this still leaves 1 in 4 who say they're not confident in knowing their child is developing a mental health problem or that they would know where to go for support. So suggesting a gap here that needs to be filled. Parents who had indicated that they'd accessed help in person from a GP or another health professional were asked to respond to 2 more items about their interactions with these professionals. 74% said they were satisfied with the help offered by professionals. However, 7% said that they felt judged, blamed, or criticised in those interactions. We also asked about interactions with educators, and most parents are reporting positive interactions. Most parents say they feel comfortable talking to educators and that they feel welcome at their child's school. So it really highlights the importance of those incidental conversations that parents have with educators. In the 12 months leading up to the 2022 survey, more parents attended online parenting programs than in person. So 1 in 8 parents said they'd attended an in-person parenting program, and 1 in 5 said they'd attended an online parenting program. So we are aware that this might reflect COVID-19 restrictions to in-person interactions that were occurring in that period leading up to the last survey, but it's worth tracking this into the future, as we know from other data we've collected that parents tell us that convenience is a really important influence on their help-seeking preferences. So parents who said they did not participate in an in-person parenting program were asked about their awareness of programs available for them to access. And 3 in 5 said they were not aware of programs for them to access. And fathers were less likely to be aware than mothers, as were parents of adolescents compared to parents of younger children. So in our sort of detailed reports, we've looked at comparisons between groups. So mums versus dads, child age, metro versus rural, areas of disadvantage, and parents of children with disability. So an area where we found lots of difference is between parents of children with disability and other parents. In our sample, 19% of parents reported their child had disability, and this is using a definition of sensory impairments or learning difficulties plus autism spectrum disorder. So we've looked at the experience of parents of children with disability compared to other parents, and parents of children with disability report more challenges, so including poorer parental physical health and mental health or distress, lower parenting confidence. They say that parenting is more demanding and more frustrating. They say they're more likely to worry, be hard on themselves, struggle with feelings of guilt and shame about parenting specifically, less likely to forgive themselves, less likely to regularly do things to relax and re-energize, and more likely to report a range of child behaviour problems, including child sleep, and also to say that they have higher levels of homework-related stress, so helping their children with homework, so lower confidence in helping their child do well at school. So now moving on to some of the, the summary and implications of our findings. Our findings suggest that most parents are faring well and have access to support from family and friends and are open to the idea of accessing support from professionals when needed. However, many parents are reporting distress and challenges in their parenting, and these findings suggest it's important to increase access to parenting support, including reliable evidence-based online information and evidence-based parenting programs. So one source of such reliable parenting information is raisingchildren.net.au. So many of you likely to have heard of this, but if you haven't, it's an Australian government-funded initiative delivering online resources and information to Australian parents, carers, and professionals caring for children. So it's been funded by successive Australian governments since 2006 to publish up-to-date, scientifically validated information about raising children from pregnancy through to 18 years. Another is the Raising Healthy Minds app. So this is an initiative of the Raising Children's Network and supported by the Australian Government Department of Health and Aged Care, and is co-designed with experts and parents with the aim to improve child mental health and wellbeing outcomes. So it's a free app aimed at parents of children 0 through 12 years, designed to help parents support their child's social and emotional wellbeing. And so you can access these resources with the QR codes on the slides here. So back to the implications. So parents of children with disability as a group are not faring as well compared to other parents. So our findings really emphasise the importance of parenting support for families of children with disability, including NDIS funded parenting support. A great support for parents and carers is My Time, which many of you may be familiar with. It's a facilitator-guided peer support program coordinated by the Parenting Research Centre and funded by the Australian Government through the Department of Social Services. So it's a welcoming, member-driven community connecting parents and carers of a child with disability. So the idea is for parents to connect with others who understand and to allow parents and carers to have some time for themselves and to build their social network. Our findings looking at attendance at parenting programs provide us a baseline for future investigations into parent use of parenting programs. So repeating this survey at 3-year intervals is really valuable, and it provides us with an opportunity to monitor changes in parent engagement in parenting programs over time. So monitoring this change is of interest to policymakers and program funders, to service providers and to researchers, especially given recent government investment in both online and in-person parenting programs. So these findings also provide insight into how policymakers and service providers can act now to increase parent participation in parenting programs. I've only touched briefly on some of our findings in this area, and you can read more in our participation in parenting programs briefing note, which you'll find on our website. So our findings also have implications for promotion of parenting programs. So it seems from our findings that many parents are unaware of the availability of important parenting support. So awareness raising efforts are needed here to ensure that families most in need of support do know where those options are available to them. So if you'd like to learn more about our Parenting Today findings, there's a lot of resources on our website. So we have an interactive snapshot that shows change across waves. So for a select number of the items that we include in each wave of the survey, they're the same, and we can track those across time. So that interactive web page is really useful for looking at that. We've also got a technical report which covers our methodology and findings in a lot more detail than we've talked about today, and also a set of briefing notes, which is represented by those little images on the slide there. So we're adding to these all the time, and these are where we take a deeper look into areas of interest and prepare a resource for a general audience. So you can go to our website for all of that. So now I'd like to talk to you about a current extension project that we're working on. So this is Parenting Today in Victoria, reaching more families. So from Parenting Today in Victoria, we have a great data set and lots of useful findings, but we know that some families are underrepresented in our data, which they often are in survey projects. So hard to reach families or service-connected families. So with funding from DFFH, through this project, we aim to extend our reach and capture the voices of parents and carers involved in Victoria's family service and child protection system. So we hope that this will provide policymakers and service providers with information to shape the parenting supports and policies to better meet the needs of families involved in the service system. So the survey will be a modified version of the survey that we use with the general population, and we aim to engage 200 to 300 parents and carers who will be able to select to complete a survey online or via a telephone interview. And we'll also follow up with a smaller number. We're aiming for at least 10 parents and carers to complete an in-depth interview. And that's to collect further information, more detailed information about their parenting experiences and help-seeking journey. And we've got funding also to provide participants with a $50 voucher upon completion of the initial survey, and a $70 voucher once they participate in that follow-up interview. So we're almost ready to go with data collection. We expect our survey to be ready in the next day or so. And we're asking agencies, practitioners to assist with engaging parents and carers in the study. So you can help by speaking to parents and carers that you work with about the study, passing on the invitation to participate to parents who've accessed your service currently and in the past, and so to contact us for information, and we can provide you with the resources you need to do that. So what I've got on the next slide is our contact details there, and also a QR code which takes you to an information sheet about that Reaching More Families project and how you can help us. So we've actually already done some work in engaging agencies. Agencies funded by Department of Families, Fairness and Housing to provide family services. We've already connected with them and let them know about what we're planning. And we'll be doing that again in the next couple of days. So your agency may have already received some information, and we'll receive this information again. But if you haven't heard, please get in touch with us, and we can be in touch more directly. And that's just some other QR codes for staying in touch via LinkedIn and e-news. And if there are any questions, Kath and I are available to answer any questions you might have.
What a great initiative to focus on what we like to call the hard to reach, but perhaps the reach, the issue around that is our reach rather than people being hard. Let's make sure that's clear. We have had a comment. We've just had a presentation where Launch Housing talked about 17,000 homeless children in 2021. And the question was, have you accessed these? And this is your effort to ensure that we have that sort of lens, yeah?
Yes, exactly. That's right.
Yeah. I mean, I was thinking about that, Melissa. Thanks for that question. We'll have those families in the data, but we haven't asked specific questions about housing situations, just family composition. So it's definitely something for us to think about for next time.
Because stress would have, as you found with the disability, families with any disabilities adds layers of stress. And it's interesting, following COVID, of course, and all the results talk about youth mental health issues, concerns about the future, greater diagnosis of ADHD and other things. Yet that group is really important. Which our clients, I think, would be often in that group. We've only got 1 or 2 minutes left, but I do want to throw to you, like, we've got a group here of practitioners, a lot of out-of-home care, residential workers. What would you say in terms of key challenges or things that they may be able to take away from your research in relation to supporting parenting of their clients in adverse circumstances? I know that's a bit of a hard question, but top of thought ideas might be good.
Yeah, it's a good question. And we'll definitely know more about this particular cohort, families experiencing adverse situations, after we've completed the extension survey. So that project where we're trying to reach more families who are service connected. But from the data over the 3 waves of the general Parenting Today survey, I'd say that a key finding that always resonates for me is that socioeconomic status, if you like, or financial situation is actually less linked to parenting factors and child well-being and parent well-being factors than you would think it would be. What seems to be most important is parent mental health and parent confidence in parenting. That seems to be related to a lot of the other outcomes that we're collecting data on. So if we can pay attention to parent mental health, the psychology of parents, how they're thinking about their parenting, the guilt and the shame that they feel, their lack of self-compassion, that they're overly critical of themselves. Those are the sorts of things that seem to be most impactful on other outcomes that we're measuring. So it's, I mean, in your work, just be thinking about how is this parent faring? What can I do today to make sure that this parent's mental health isn't impacting on their well-being and on their interactions with their children?
Yeah. Thank you so much. It's a really interesting piece of work, and I've loved the fact that you've shared it with the broader sector, because I think it will have a lot of interest